Hello and welcome. Today we'll focus on LO3, understanding strategic and business plans for healthcare organizations through environmental analysis. We'll explore how healthcare organizations align their strategies with their missions, tackle challenges, and seize opportunities. Strategic planning in healthcare involves actionable steps to achieve specific goals. It's essential for aligning actions with an organization's mission. Current trends demand more patient-centric approaches. Organizations need to recalibrate strategies to suit market changes. Understanding these strategies is crucial for success. A comprehensive business plan includes an executive summary, operations, and people management. Market analysis and marketing strategies are crucial. Financials and risk assessments are key components. An appendix often supports the plan with detailed information. These elements guide healthcare organizations in strategic planning. Health organizations play vital roles nationally and internationally. They include public entities, private providers, and pharmaceutical companies. Charities also contribute to health promotion. Their administration and funding vary widely. Understanding their structure aids in strategic planning. Healthcare faces barriers like accessibility and funding issues. Social and transport challenges affect access. Costs of treatment and insurance pose financial barriers. Risks from conflicts and pandemics impact delivery. Addressing these barriers is crucial for effective planning. Strategic and operational planning outlines objectives and implementation steps. It aligns with the organization's mission and market trends. Healthcare providers must adapt to patient needs. Effective planning ensures resource allocation and risk management. It supports long-term success in healthcare. Consider a community health center facing patient wait time challenges. Strategic analysis identifies strengths and weaknesses. Opportunities like grants and partnerships are explored. Threats include competition and budget cuts. Strategic choices are evaluated for best outcomes. The best strategic choice is a technological upgrade. It addresses key weaknesses like outdated systems. Grants support technological advancements. Telemedicine reduces patient load and increases satisfaction. This choice future-proofs the center and is cost-effective. A business plan for technological upgrades includes an executive summary. Situation analysis highlights current challenges. Objectives focus on reducing wait times and increasing satisfaction. Strategy and implementation outline digital health and telemedicine. Budget and financing detail costs and funding sources. Implementing a digital health system is key. Staff training ensures smooth adoption. Online scheduling improves patient flow. Telemedicine offers convenience and efficiency. Promotion increases awareness and usage. Estimated costs cover digital systems and telemedicine platforms. Grants aid in financing the upgrade. Annual budget allocations support implementation. Partnerships with local businesses are explored. Clarity in financial needs ensures successful execution. Regular surveys assess patient satisfaction. Utilization rates of new services are monitored. Monthly wait times track improvements. Financial returns and cost savings are reviewed. Evaluation ensures ongoing success of the plan. Identifying risks like resistance to new technology is crucial. Contingency plans include additional training. IT support addresses technical issues. Data protection ensures patient privacy. Preparedness enhances plan resilience. Incorporate a detailed ROI analysis for financial projections. Engage stakeholders early for valuable insights. Conduct thorough vendor evaluations. Pilot programs help address initial challenges. Ongoing marketing promotes service adoption. Robust data protection strategies safeguard patient information. Secure platforms maintain trust. Compliance with regulations is essential. Regular audits ensure data integrity. Security measures are integral to successful implementation. Strategic and business planning in healthcare requires aligning choices with strengths and opportunities. The technological upgrade in this scenario addresses core challenges. By following a structured business plan, organizations can enhance service delivery and achieve success. If you have any questions, please feel free to contact us via WhatsApp at 0748-436-1688. We look forward to seeing you at the next session. Thank you for your attention.